Most of the experts are predicting another spike of COVID-19 cases in the country. So this is what we have been calling the third COVID wave. After having seen what happened during the first and second waves, where so many people were infected, the hospitals were flooded with sick patients, and so many people lost their loved ones, we are all apprehensive about the third wave, understandably. So what has been happening from early 2020 when the virus got introduced into our country is basically a cycle of events. There are at times when the virus triumphs over us and the number of cases of COVID surge in the community, that actually constitutes a wave. And then we go on the defensive, we lock down, we shut down, we start practicing social distancing, we all start wearing masks. So this actually prevents the spread of virus in the community, the cases come down, and then we all relax saying that the wave has just passed and probably the another wave will not be there. So it was this complacency that led to such a devastating second wave after the first wave of coronavirus infection in the country. We have witnessed the second wave just a few months ago, and now that the society is open to life as usual, we are seeing a lot of people on the roads not wearing masks. Social distancing is not being followed. Vaccinations have been going on in a big way, but we have not yet reached a mark where most of the people are vaccinated. So the substrate for the virus to infect large number of people in the community is still there. That is why most people, most experts are actually expecting that there will be third wave in the country. There were talks of children getting affected disproportionately during third wave. However, now there is lot of evidence from our country and from the other countries that during the first and second waves, children were not disproportionately affected. They were as often affected as the adults. However, they were more likely to remain asymptomatic or develop mild symptoms, and probably many of them did not seek medical attention, many of them were not tested, hence were not reported. But scientific studies have shown that children and adults were equally affected during the first and second waves. So it's very unlikely that the third wave would disproportionately affect the children. And even if kids get affected, it is likely to be an asymptomatic infection or a mild infection in most of the children, and the complications are expected to be uncommon. If at all, if complications happen, then most of them can be managed provided they seek attention of doctors at an early stage. We all know how deadly coronavirus infection can be. Although in most individuals it does cause mild to moderate illness, in a substantial number of individuals it can lead to a very severe illness and even death. So when you look at things that can prevent coronavirus infection, vaccination is an extremely important measure. If you look at history of humanity, it is the infections that change the course of the world, leading to lot of sufferings and lot of deaths. And major milestones in modern medicines are actually availability of vaccine against some of these deadly infectious diseases and how we were able to conquer such diseases. For example, polio is eradicated from our country, and this was largely possible because of the availability of an effective and safe vaccine, and also collective efforts of the entire society in accepting polio vaccine. Now is a time when we as a society have to understand that vaccination against COVID is everyone's responsibility, and it is extremely important for all of us, not just as individuals but as community people, and we have to get vaccinated and also encourage others to get vaccinated. So let's all get vaccinated against coronavirus and prevent this disease in the community.